So what is the prostate and what is prostate cancer? And a reminder that each of these sections will start with this QR code, which links you to our webpage with updated information. So what is the prostate? The prostate is a small reproductive organ. This is a side view of the anatomy. So you can see the prostate here sits underneath the bladder. The urethra, the tube that drains the bladder, comes right through the middle of the prostate on toward the penis here in the urethra. This is the sphincter muscle that holds in the urine and drives continence, urinary control. And the prostate sits in front of the rectum. So this is how we're able to feel some tumors with a finger exam, a digital rectal exam, and how we're able to do biopsies through the rectum into the prostate here. The prostate has two jobs. One is to make some of the fluid that comes out with ejaculation. It makes seminal fluid that surrounds sperm, and it helps push that fluid forward through the penis at the time of ejaculation. As you can see, the urethra is much longer from the prostate forward than the path would be to go back into the bladder. So if the prostate is not there to close off the neck of the bladder at the time of ejaculation, this fluid would go back into the bladder. So what is prostate cancer? Well, any cancer by definition is an abnormal growth of cells from one organ and spread of those cells to other parts of the body. Prostate cancer then is abnormal growth of prostate cancer cells to a point where they are able to spread. First, typically to the lymph nodes, which are part of the immune system, and then to other organs, most commonly bones. Prostate cancer is extremely common. Almost over 250,000 men every year in the US are diagnosed with prostate cancer, making it by far the most common cancer that we diagnose among men in the US. And frankly, it's even more common than that. If we look at autopsy series, so men who die of other causes, and we look hard enough, we will find prostate cancer in most men if you live long enough. But of course, most of these are completely clinically irrelevant. And a lot of us are starting to say we shouldn't even use the word cancer when we find something that has no biologic capacity to spread or cause symptoms or threaten life. So over 30,000 men a year still die of prostate cancer in the US. It is the second most common cause of death among men in this country and the fifth leading cause of cancer death around the world. But you can see here the number of men who actually die of it is far, far lower number than the number of men diagnosed, partly because we cure a lot of cancers, but also because a lot of the ones that we find and give this cancer label are not, in fact, cancer the way we think of it in society. Now, everybody wants to know why this happened. Why does a man get a prostate cancer? Well, any cancer reflects a combination of genes and environment. So the genes are the DNA that you're born with. You get half your DNA from your mother, half from your father, and there are some genes which predispose to cancers, things like BRCA2, CHEK2, ATM. There's a whole series of genes that we know about and others that we do not know about, which help drive predisposition to cancer. And then there's environmental factors. And this is everything else that happens to you from the moment development starts, from the egg and sperm on forward to everything that happens in life. Exposures during development before you're even born, diet, stress, smoking, exercise, many things that are in your control in terms of what we think of as lifestyle factors, and many things that you cannot control. Pollution, literally exposure to cosmic rays, a lot of this ultimately comes down to what we call bad luck. We do not know why many of these ultimately form. And the big question, of course, is what are the odds of actually dying of prostate cancer when it's diagnosed? And the answer is that it depends, and it really depends critically on the risk of the cancer. So only a subset of prostate cancers that we find and that we label cancer actually need to be treated. Most men who get the diagnosis of prostate cancer would never know they had it if we had not gone sniffing around, checking PSAs and doing biopsies. And most men with prostate cancer typically ultimately die of other causes, most commonly cardiac disease, because that's what kills most men in America. However, the subset, the aggressive prostate cancers can spread. They can be lethal. They can be cured if we catch them within the right window of opportunity. And these are the ones that we're looking for, is the ones that, if we do not find them, could potentially be lethal. And we need to make sure that our treatment decision-making reflects our understanding of disease risk. So low-risk cancers should be managed with active surveillance, meaning we just keep an eye on it with PSAs, with repeat imaging tests, biopsies, not treat. And this is appropriate for almost all low-risk disease. And we'll talk in a minute about what exactly defines low risk. Slightly higher risk tumors can be managed with focal therapy, where we treat the tumor, leave the rest of the prostate alone. The ones that are solidly middle of the road will do well with surgery or radiation therapy. Still higher risk cancers should be treated with a combination of treatments, radiation together with long-term hormonal therapy, for example, or surgery followed by radiation. And then finally, the ones that are already metastatic when we find them, or we find them too late, are treated primarily with systemic treatment, with hormonal therapy, immunotherapies, other treatments that treat the whole body and not just the prostate.